more on this, we're joined by Dr. Kate Tulenko. She's the founder and CEO of Corvus Health. Always good to speak with you, Kate.
Thank you.
So first of all, what should we know about this disease and how dangerous is it?
Well, first of all, the name monkeypox is a misnomer. It's not generally transmitted from monkeys. It's just called monkeypox because it was first isolated from monkeys in a laboratory. So it's a disease very similar in some ways to smallpox, but much, much milder. And actually, we shouldn't be too worried about it. It can be controlled by the smallpox vaccine. There are also several viral treatments as well as immunoglobulin treatments for it. I think that we're seeing it now because there's been a 2-year pent-up demand for travel, pent-up demand for socializing, but also, on the positive side, I think our laboratories and our physicians and health workers are now really looking for outbreaks, and so they're being spotted, whereas in the past they would not have been spotted. But monkeypox is much more difficult to contract than COVID. So anything you do to protect yourself from COVID, good hand hygiene, not touching your hands and face, wearing a mask in close indoor spaces, all of that will protect you from monkeypox.
So you say we shouldn't really be worried about it, but in the past 2 weeks, we now know monkeypox has been detected in at least half a dozen European countries, here in the US, even Australia. Are we blowing this out of proportion? I mean, because we hear the WHO having an emergency meeting, all these kind of cues us to kind of think that we really should be concerned.
Well, I think this is just because we're on high alerts for pandemics right now. There are 2 versions of monkeypox. There's one from Central Africa, which is more deadly, about 10% mortality, and then there's one from West Africa, and this one appears to be from West Africa because they've sequenced it, and also the first person in Britain diagnosed with monkeypox had just come from Nigeria in West Africa. And also, monkeypox is not on the list of viruses that people are concerned about being weaponized. So really, I think there's the attention to it because we've been sensitized around pandemics. And if we all just do the things that we need to do to protect ourselves from COVID, we will protect ourselves from monkeypox. And then another interesting thing, as the epidemiologists have investigated this outbreak, many of the people who've caught monkeypox seem to be in the men who have sex with men community. So it's believed that they got it from the same party or got it from intimate contact. And so really, once again, people just need to protect themselves from COVID. And looking from an American perspective, about 30% of Americans live in communities with COVID local transmission rates of moderate to high. So really right now, you're much more likely to get COVID than monkeypox.
Right. Okay, so there is currently no proven treatment for monkeypox, I believe. What's being done to help patients who do contract the disease?
Right. Well, there's not a proven treatment because it hasn't been a problem in the past, but there are several treatments that they believe will work. There are several viral treatments that have been proven to work in animals and in vitro in a petri dish. And there's the cowpox immunoglobulin, which is another related virus, which is believed to work against monkeypox. So people who have monkeypox who seem to be not doing well or immunocompromised or have other diseases will probably receive these treatments. And normally the mortality rate for monkeypox is about 1%, but that data is generally from Africa. So I would be very surprised if anyone in North America, Europe, or Australia died from the monkeypox. The only reason they would is because they were immunocompromised or had other diseases.
Right. Dr. Kate Tulenko, always good to speak with you, and thank you for calming our fears.